This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmandrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Nice to meet you all. My name is Elizabeth Callahan. I'm one of the PGY4 chief residents at NYU PM&R Residency Program, and I'll be spending a few minutes this evening describing our program to you all. So NYU's history goes back to Howard Rusk, who came to NYU in 1948 and established the first university-affiliated department in rehabilitation medicine. And since the program has had many firsts, first aphasia protocols, vocational reintegration, first pediatrics program, rehabilitation psychology, and the department renamed Rusk Rehab in his honor in 1984. The mission statement of Rusk is to provide patients with the necessary physical, social, emotional, and vocational and recreational skills to reach the highest possible level of quality. So we use this in our outpatient settings and in our residency training. This is our program leadership. So our chair is Dr. Stephen Flanagan, who is the president of AAPM&R this year. We also have Dr. Alex Burrows, who is our program director, Dr. Frank Lopez and Dr. Surain Devakumar as assistant program directors. And then we have 6 chief residents, including myself, on the right of the screen. So our residency program is quite large. We have 36 residents, 12 in each class. And we have 2 fellowships in the department, brain injury and sports medicine. As many of you know, our training starts with the intern year in medicine, surgery, or transitional year. Then we go into PGY2, which is mostly an inpatient focus. Majority of the year is spent managing TBI, spinal cord injury, orthopedic rehab, amputees, and rehab emergencies on the floors. Then PGY3 is less inpatient, more outpatient. We shift more towards outpatient clinics and consult services. We introduce pediatrics and procedural skills, including EMG, musculoskeletal ultrasound, and fluoroscopy. And then PGY4, we include consults, even more outpatient, and then developing some leadership skills and career planning. We have a good mentorship program within our residency program where all incoming PGY2s are assigned to an attending mentor and join a resident family that includes a PGY3 and a PGY4. So where do our alumni go? Over the last 5 years, we've had lots of alumni complete fellowships in ACGME pain, sports, and pediatric rehab, as well as spinal cord injury, going to many prestigious institutions listed here on this slide. We also have many alumni going off to the NAS Sports and Spine Fellowships, and then many other non-ACGME PM&R fellowships, including cancer rehab, non-operative orthopedics, and amputee. Many go on to academic jobs as well as private practice. And here at NYU, we have fellowships in PM&R sports and TBI, as well as the anesthesia program has pain medicine and palliative care within internal medicine, and the neurology has a neuromuscular medicine fellowship. During your residency, you'll rotate between 3 different institutions, including NYU Langone Health, New York Health and Hospitals Bellevue, the public city hospital, and then Manhattan and Brooklyn VAs. These are where these are located. So if you like zoom out on a map of New York, these are actually all within each other on the east side of New York, which makes it pretty convenient for life as a resident. Our inpatient sites include Tisch, which is 22 beds. That is the location listed as number 1. Bellevue, the location listed as number 2, which includes 30 inpatient beds. and then Langone Orthopedic Hospital, which is listed at number 3, which includes 48 beds. And then our outpatient clinics are varied in between, mostly up at the ACC and LOC locations up on the top of the map. And these span a variety of musculoskeletal, pain, sports, and general rehab outpatient clinics. So our inpatient sites all use Epic, which is very helpful for continuous care and getting familiar with an EMR as a resident. Back to our outpatient clinics, I kind of already mentioned this, but they include sports, pain, EMG, cancer rehab, TBI, cardiopulmonary clinics, brace clinics, and more notably muscular dystrophy and diabetic foot and ankle and dance clinic, which are things I hadn't seen until my time at NYU. I think that sets us apart. Our dance clinic is quite interesting. It's called Harkness Dance Center. We work with a lot of professional dancers and performing artists within New York. So our residency schedule is listed here, broken up between PGY2, PGY3, and PGY4 years. As you can see, the hours decrease as you get more senior. We are front loaded in that sense, and also in the sense of PGY2 being more inpatient focused. Basically, PGY2 year is broken up with 8 months of inpatient rehab in blocks of 2 months at a time. So you'll do 2 months of Bellevue inpatient, then an outpatient rotation, followed by 2 months of inpatient at Langone Orthopedic Hospital. So personally, I really enjoyed this, being able to break up my inpatient duties to outpatient. And then you have some senior site helpful learning opportunity to oversee some PGY2s and be more of like a junior attending role and start to learn some of the things you need to look out for in an attending position. And then PGY4 includes some time doing EMGs as well as PGY3. PGY4 also includes some elective time and some procedure months. So our call sites, notably all of our call is in-house call, which gives you the benefit of a post-call day. We take call only on the weekend during the days, actually from 7 a.m. to 7 p.m. at HCC 9. And then the other 2 inpatient sites at Bellevue and Langone Orthopedic Hospital, those are 24-hour calls where we have call rooms at each with beds and everything you need to stay overnight. Very important, we do have critical care and medicine consults available at all sites 24/7. This helped me a lot in terms of managing acute emergencies on the rehab floor. I knew I always had people I could turn to and consult. So our call frequency ladder, again, more front loaded. So you get a lot of your calls out of the way your PGY2 year. You have about 2 to 4 a month, which is about 40 calls a year. Generally 2 calls per month will be weekend shifts. And then you do have one month without call while you're on the Manhattan VA. During your PGY3, you have about 3 calls per month on inpatient sites, and then 2 calls per month on outpatient sites, which totals about 23 calls a year. One of which is on Sundays, but there are no Saturdays once you make it to PGY3 year. And then you have 2 months without call while you're on the VAs, both Manhattan and Brooklyn VA. And then PGY4 year, it lightens up even more. You have about 2 calls per month or about 8 calls per year. 2 calls per month while you're on inpatient, which is only 4 months, totaling 8 calls per year. And these are only Monday to Thursday, no holidays. You do have 2 Sunday 12-hour shift calls throughout the entire year. And this totals about 5 months without call. Our pay and benefits are competitive for the area. New York is obviously an expensive place to live, and NYU, along with the other hospitals nearby, we do salaries a bit higher to compensate for the higher cost of living. They did just negotiate higher salaries, which I have listed on the slide here, which goes into effect in 2 months. So I guess the good thing here is they do listen to the residents' complaints and trying to get us, things that we feel we deserve as residents. We do have 20 days of vacations, which we take as 5-day blocks. The chief in charge of scheduling tries their best to bookend these days by weekends as well as a Thursday call, so you can have a Friday post call leading into your vacation week. Additionally, we have 10 sick days each year, and then we have a choice of medical, dental, and vision plans.
as well as comprehensive mental health resources. And we have an education stipend fund, which gets replenished annually. And then a conference fund, which we use for all 3 years. And we have the opportunity to make additional income using what we call an EWEP, or extra work, extra pay system, where residents can do weekend admissions for $100 an admission. Just wanted to note that these are NYU salaries. We do have a few residents on the Bellevue payroll system, and it's the payroll system that is funded by the New York City Health and Hospitals program. So these numbers are, to be transparent, they are slightly lower, and they're lobbying now to make these equal to the NYU salary. Some technologies we have available to us at NYU. The department provides its iPads, which we use for our books, medical apps, and Epic usability. We have ultrasounds at each of our sites. Ultrasound has become a huge part of our didactics for musculoskeletal ultrasound, so we have the opportunity to practice at each inpatient site. We also have SonoSim online ultrasound course, which we use in tandem with our ultrasound didactics. We have injection models, both peripheral joint and spine models. And then all of our books are provided through NYU's virtual library. That leads us to our curriculum. This is protected and truly protected didactic times. That's on Tuesdays from 12 to 3. We use a 12-month cycle. So the goal is that you see this material 3 times throughout your residency. We do ultrasound workshops every 6 weeks, and these are on peripheral joint. So we'll start with the shoulder, then move to the elbow, and move distally to the wrist. And then same thing for the lower extremity, start with the hip and move distally. We have weekly journal clubs where one resident will present a relevant journal topic related to our didactic sessions, and all sites will participate via Zoom on Fridays. We have grand rounds, that's the first 3 Wednesdays of each month. We have mentorship lectures, a research didactic curriculum, and then we have the opportunity to attend annual prosthetics and orthotics and board review courses provided by NYU during your PG/4 year. I believe we have a supportive culture here at NYU between co-residents and attendings. We do always try to improve our residency program for future generations. I think the program leadership, including program directors and APDs, are very open to listening to changes we bring to the table. And we have these quarterly town halls with our chief residents and program directors to voice some of these concerns or any changes we think would be beneficial to the program. Most things here are resident driven. I believe we have a good work-life balance. And then we do have a supportive culture for new parents and families. Living in New York, New York has plenty of opportunities. A few pictures are highlighted here. We have residents who have run the New York City Marathon. We have residents in the bottom enjoying a Mets game. In the middle, we had a wellness didactics instead of lecture where we went ice skating. There's 5 boroughs to explore. There's plenty of opportunities to find what it is you love to do outside of the hospital. Endless entertainment from Broadway to professional sports. And it is easy to access New York and other cities given our transportation hub and then nearby airports. These are some of our residents. We just want to highlight some fun things we've done over the last few years. We do always have a big group going to PM&R and AAP, which is the benefit of having such a big residency program. Some of these pictures are from those conferences. And here's my name and contact. You guys are more than welcome to contact me with any questions, as well as our program coordinators, Sophia Vargas and Kirsten Horvath. They are open to answering any questions you guys may have as well. Thank you so much.
Awesome, thank you. We'll see if we have any questions come in through the chat.
Hey, Ashley, I see your question about electives. We do have elective rotations during the PG/4 year. There's 2 months of electives. Do we have a research track? We don't have a specific track, but there is plenty of opportunities to do research at NYU. And we have built-in research days during your outpatient rotations, which include 1 month of your PGY2 year. So it's a nice way to get involved in research at an early time in your residency. How strongly does your program value geographic preference, ties to the region, and signals? From what I know, we do have a lot of people from New York in our program, but I don't believe that our program values your you being from New York in terms of our ranking system. And signals, I'm not too familiar with myself. I don't know the answer to that question. Do we accept IMG? We do. Any USMLE cutoff or graduation date cutoff? Not that I know of. Any elective rotations for med students? Yes, we do. You can contact, I'm going to change my slide here. Contact Kirsten Horvath at the email here if you're interested in rotating as a medical student. We love having medical students from outside programs come visit with us. Do you feel you got to explore subspecialties enough to make a decision on what fellowships you would want to do? I do. I think this is actually a pro of our PGY2 year, including outpatient exposure. And I think it gives you a broad range of everything during your first year to help make an informed decision about fellowships you might be interested in. The only thing we don't have a ton of exposure to is pediatric rehab. We have exposure in the outpatient setting, but not in the inpatient setting as of now. And that is hoping to change in the near future to get acquire a new inpatient pediatric rehab floor. Do you get exposure to sports coverage? Yes, we do. So we work closely with our PM&R fellow and cover St. Joseph's University in Brooklyn. They're a D3 school, and we cover all of their sports year round with the fellow. So this will allow one resident to join them per game, and we send out a sign up for residents to come to each game with the fellow. And additionally, we have affiliation now with the Gotham women's soccer team, professional soccer team, so we can go to some coverage with the attending when they're there. It covers their team, as well as we always have a group doing the New York City Marathon as well, and other New York Roadrunner races. Thank you guys for all the good questions. Anything else I can help answer?
Ari, it doesn't, oh, nope, it looks like there is another question.
Hey, Dorothy. So if you're interested in joining our didactics online, I'd be happy to help set that up for you. You can actually contact me via email. My email is listed here, elizabeth.callahan@nyulangone.org. I work closely with the medical students, and I can be happy to get you guys our Zoom login for our didactics so you can see a session. Not a problem. Yeah, anytime, no problem.